The views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
And hello, welcome to Open, the show that opens the Bronx and the rest of the world right to you. I'm Daren Jaime, and today we're going to update you on what's happening in and around our borough. Coming up, Montefiore is holding their 12th annual breast and cervical cancer screening. We're going to discuss it a little bit later on in the show. And then afterwards, we'll learn more about Bell's palsy and how you can better diagnose the condition. And then a little bit later on, the Vice Chair of OB/GYN Services at Jacobi Hospital will sit down with us in studio discussing the importance of visiting a gynecologist. And after that, September is National Thyroid Cancer Awareness Month. We're going to learn about an interventional endocrinology program Columbia University Irving Medical Center has developed. And then we're going to get a preview of the film Equal Standard when we sit down with the creator and executive producer. So stay tuned, because all this and much more is heading your way, because right now, we're officially open. And hello, everyone. I'm Daren Jaime. Today is Wednesday, September 25th. You're now watching Open, a live program bringing the Bronx and New York City straight to you. We want to welcome our viewers on Manhattan Neighborhood Network, as Open is also being broadcast simultaneously on MNN's channels. Now you can stay connected to us on all of our social media platforms at BronxNet TV. Well, some things have been going on through the past week. We're going to take you through it right now with some Bronx updates. Bronx man dies after jumping in front of the number 4 train with his daughter in his hands. The incident happened on Monday morning at the Kingsbridge station right here in our borough. 45-year-old Fernando Balbuena Flores jumped onto the tracks while holding his 5-year-old daughter and was hit by a southbound number 4 train. Medics pronounced Balbuena Flores dead at the scene. However, once the train stopped, a video of 2 Good Samaritans rushed to save the 5-year-old from under the train. Here's a clip from the incident.
Oh my God. Oh my God. Little my little, my love, little my little. Little my little. Ay, Dios mío, Señor, gracias.
Amazing video. The 5-year-old was not harmed by the train and was taken to Jacobi Hospital to be treated for scratches. Well, in other news, Bronx Borough President Ruben Diaz Jr. is holding a ceremony at Bronx County Building. Our BronxNet reporter, Ashley Tiffany, is there to bring us more right now.
Good morning, Darren. We're here live at the Bronx County Building. Bronx Borough President Ruben Diaz Jr. is honoring 2 Bronx Brave heroes. Back to you in the studio.
Okay, we believe that the Bronx Borough President will be speaking soon. Of course, we will bring that to you as soon as it becomes available. Our BronxNet cameras are at the ceremony at the Bronx County Building. And of course, as we said, more information as it becomes available. Well, we're going to take a quick break. We're going to have more Open. Stay with us. We'll come right back right after this. And we are back. Montefiore is holding their 12th annual breast cervical cancer screening event, helping to prevent and educate women and families about the disease. Now, joining us to tell us a little bit more about details is Dr. Della McCower, who's a medical oncologist at Montefiore Health System and also the associate professor at Albert Einstein College of Medicine. Doctor, thank you so much for joining us.
Thank you for having me.
So when we talk about this here, I mean, obviously breast and cervical cancer, major numbers across the nation, but
Yes.
How do we fare here in our borough?
So I think really the important thing to know is that women with breast cancer affects a large number of women, 1 in 9, that Black women tend to have a higher risk of dying of breast cancer. And that is in part because of disparities in care, and in part because they tend to have a more aggressive form of breast cancer called triple-negative breast cancer. And so because of that, screening for breast cancer is really, really important, because early detection saves lives.
Right. And early detection does save lives, and I know that's the part of the reason why you're creating this awareness.
Exactly.
Right here across the borough, we're seeing a lot of things happen. Talk about what happens at a screening and at an awareness ceremony, an awareness event, because you got one coming up.
Right. So basically, this is a breast and cervical cancer screening event. Women can either register and have an appointment to come in, or they can just walk in. We offer pelvic exams and pap smears, as well as breast exams and mammograms. We have a radiologist on site who can take a look at the mammogram. If there is anything that looks concerning, we can arrange for a biopsy, often that same day if needed. And we will take anybody who wants to come in. So if they're uninsured, that's okay. Undocumented, that's okay. If they have insurance, we'll take that too, although copays will apply if they have insurance.
Right.
But anyone who wants to come in who meets medical guidelines for screening can come in and be screened on that day.
Of course, there's this heightened fear when you hear the word breast cancer, when you hear the word cervical cancer, when you hear the word cancer altogether, right?
Right.
So walk us through a little bit about, it's not the final, there are things that can be done, and after diagnosis, there's treatment and options.
Absolutely. So the important thing to know about breast cancer is that the vast majority of women with breast cancer are cured. Almost 90% of women with breast cancer are cured. And that the earlier that breast cancer is caught, the more likely that breast cancer is to be cured. So early diagnosis saves lives, and of course there's a huge amount of fear associated with a breast cancer diagnosis or with any kind of cancer diagnosis, but we have very, very effective treatments for both breast and cervical cancer, and that the majority of women with breast and cervical cancer are cured of their disease.
And so when you talk about breast and cervical cancer, the diagnosis, we know that that's, it's rough on a family, it's rough for people that actually, do this. Now you talk about care. And I was talking with someone just this week, stage 1,
Right.
Was diagnosed with stage 1, but there's this huge sense of optimism on
Right.
their part, because they feel as though that even though it was early, it's caught early, it can be dealt with. And I think you
Absolutely.
emphasized that just a few minutes ago, that this is beatable.
Exactly, and they this person in your life who has stage 1 cancer should be optimistic, because the vast majority of people with stage 1 cancer are cured. It does involve treatment, it involves surgery, it may involve radiation, sometimes, but not always, can involve chemotherapy, and sometimes involves hormonal therapies. So it is a process, but at the end of the process, the goal is early detection and the goal is cure.
All right, so October 5th is a big day for you.
Absolutely.
And a big day for us here in our borough. You're actually having an event that's dealing with this, so walk us through what's happening.
So at the event, it's October 5th. This is an event that has been occurring for many, many years. This is the 12th annual Edward Greenwald Breast and Cervical Cancer Screening Event, and it's named after one of my teachers and mentors, Ed Greenwald, who ran this event back when, I was in my training to be a medical oncologist. So this has been going on for many years in this community. We basically, it's screening, early screening, diagnosis, physical examinations, and hopefully good news for the majority of people who come.
So October 5th, I want to let you know that you can come out from 9 to 1. We'll give you that information just a little bit later on. But once again, the numbers in our borough, how do we fare comparing to other boroughs across the city?
Really equivalent to other boroughs in the city. Again, that's the importance of diagnosis, early detection, and treatment.
Yeah, and we talk about that. So listen, in terms of 200,000 women are diagnosed with breast cancer each year in the United States, and in New York City alone, 111,870 new breast cancer cases have been diagnosed here in New York.
In
so
New York,
you
yes.
you got a lot of work ahead, huh?
Yes, 1 in 9 women. It's a very, very common condition.
What are some of the biggest challenges that you're facing when you're out there hitting the streets trying to make people aware?
Well, I think it's important to, spreading the word, making people know about the event. I think fear is a very, very big concern. People are scared. They don't want to know. But it's important to actually, face fear, go have your mammogram. People are concerned it may hurt. People are concerned that they, don't want to find out bad news, but because really, I can't say this more strongly enough, early detection saves lives. It really is important to.
Yeah, and Dr. Dell, we're going to do our job to get the word out. Thank you so much for coming and sharing with us. And I want to let you know now, listen, Montefiore's breast and cervical cancer screening event is taking place on Saturday, October the 5th. That's from 9 to 1 at the Tower in Montefiore Medical Park's Einstein campus. Now, you want to know who that is? That's 1695 Eastchester Road. Now, if you need more information, you can visit their website at montefiore.org/cancer or call 718-405-8076. Once again, 718-405-8076. We are taking a quick break, but we do have more shows, some more great guests. Stay with us. Open is continuing right after this. And thank you for staying with us. Approximately 40,000 individuals are diagnosed with Bell's palsy in the United States each year. However, many individuals are simply not aware of the condition. So you got to ask the question, what are some of the possible symptoms? What causes the condition and how is it diagnosed? Well, here to tell us a little bit more is Dr. Jessica Zwirling, who is director at Montefiore Hudson Valley Center for Excellence and Alzheimer's Disease. And good to have you.
Thank you. Thank you for having me in the studio.
Good. I remember dealing with a couple of people, and it seemed as though the question was Bell's palsy, stroke. You had that kind of, thought process. Later found out that it was Bell's palsy. Totally, I was totally lost. And I think it was the first time I was introduced to it. But I think for a lot of, New Yorkers and people across, the United States, sometimes people just don't know exactly what Bell's palsy is. So why don't we just have a moment for education purposes and share with people what Bell's palsy is about?
Sure, you bring up a great point. It is part of the differential where we think about stroke and we think about Bell's palsy. It's a weakness of the seventh nerve, which is the facial nerve, which can affect our ability to close our eyes and move our mouth. So it can present like a stroke, and it is one of the warning signs, facial weakness of a stroke, that we try to remind people of. But Bell's palsy is actually not a central phenomenon. It's actually a process that affects our peripheral nerves. It's a common, like what we call mononeuropathy of the facial nerve, and commonly you can have weakness of the facial muscles, which can cause some drooling, some difficulty with speech, which actually can mimic a stroke.
Right. So what exactly causes Bell's palsy?
So there's a couple of theories behind it. It really is inflammation of the nerve, of the seventh nerve as well. There are some theories that it could be from the herpes virus or some of the zoster viruses, but it really is just a main inflammation of the nerve, of the seventh nerve.
So it just occurs? How does it,
It can have some viral etiology, but given the mainstay of treatment is prednisone and treating the swelling, it can be an inflammation of the seventh nerve that can cause that weakness.
And so when you see a person, the question is, there's a little fear and panic there too, right? Because my face is a little contorted, I don't look right. I'm wondering, how long is this gonna last? What's this process gonna be like? So you're the doctor, walk us through.
Right.
How long does it usually last, and what's the process like?
So the process is you can notice some weakness on the side of the face. We'd like to teach people about warning signs of stroke. So if you're with someone and they have difficulty speaking with weakness on one side of the face or weakness on one side of the body or difficulty really articulating, that's actually an emergency or something that could be a pending stroke. As far as Bell's palsy can last. Most people improve. The treatment is really important within the first 72 hours in starting prednisone. And that treatment and that prognosis can be, most people improve over 2 months. People that have a severe weakness to the side of the face can have difficulty over several months, but overall it's a common disease with a good prognosis.
So you go home, you deal with this, and what about home? What are the treatments? Is there anything I'm doing on a daily basis at home? or am I just letting things naturally take its course?
Prednisone is a steroid that can be initiated within the first 72 hours. In addition, some of the side effects are you want to protect the eye. So your eye may not be able to completely close. When we go to sleep, if you have weakness of eye closure, that eye will remain open, which makes you very vulnerable to any kind of cuts or on the cornea itself. So we give lubricant for that as well. So some of the doctors that may be involved, you should see your primary care physician, otolaryngologists or ENTs are commonly see this disease, neurologists, this is a common phenomenon, but something that is easily diagnosed, treated, and with a good prognosis.
So specifically at Montefiore, how do you deal?
We see this commonly in the emergency room. I always say to my residents, if you're seeing it in the emergency room, you can think about a stroke, but no one's going to be faulted for bringing someone in to do more of a workup. Common conditions associated with Bell's palsy can be Lyme disease, can be diabetes. We sometimes see it in the late trimester, in pregnancy. So this is commonly seen in our outpatient offices. This can be really evaluated and treated in our primary care offices, as well as our ENTs and our neurologists.
How long does it take to make that diagnosis, right? Because I think, you know, I remember the person was talking about Bell's palsy, stroke. They seemed to be there for a little minute. It took a minute to make that affirmative diagnosis.
Well, weakness of the face can mean a couple of different things. There are rare genetic syndromes that may affect a recurrent Bell's palsy, but in the context of just your garden variety Bell's palsy, you want to make sure there's no hearing involvement as well that may look to possible an acoustic neuroma that can happen at one of the angles of the brain. That would mean that there was a lesion or a tumor that would be in the brain that would need more imaging that wouldn't just affect the peripheral nerve. Other disorders you want to make sure that happens when you have acute facial weakness are things like Guillain-Barré, which can cause acute facial weakness, which have to be monitored. But commonly this disorder is recognized. And one of the funny things about nerves is that we can rejuvenate, and that an injured nerve can branch out. So some of the side effects can mean something called crocodile tears, but you can have excess tearing with chewing, which is a phenomenon that can be burdensome for patients long term, but really not a very common sequelae after Bell's palsy.
And what about genetically? Is it genetic? How genetics play out?
There's a rare syndrome called Malcolmson-Rosenthal syndrome, but this is a disease that happens in our population from ages 15 to middle age, and it's just really being aware of some of the common signs that you brought up yourself about being aware. Is this a stroke or is this related to Bell's palsy? And making that awareness that any change in speech and any change in what someone looks like in their facial expressions is important to recognize and seek treatment.
Someone who seeks treatment, they get through it, they're doing a little bit better. Of course, always that fear of reoccurring, right?
Right.
Is that a possibility, strong possibility? How does that work out?
Very small possibility. Recurrence rates are usually less than the 7% range unless there's a genetic variant, and that genetic variant has associated oral facial swelling, tongue fissuring, and not a very common genetic association. So prognosis is good.
So before we go, please share a little bit about Montefiore and the great work that you're doing, particularly with this.
With Montefiore, we work closely and collaboratively with our otolaryngologists. And in the neuromuscular realm, we may do what's called blink reflexes and look at prognostication for Bell's palsy. There's a lot of things. There's a lot of buzz about acupuncture also in the treatment of Bell's palsy. I'm looking forward to seeing more organized and randomized controlled trials, really doing head-to-head trials on prednisone and acupuncture to see if that's really a great treatment for Bell's palsy.
We'll be looking out for it, but certainly thank you for the awareness, thank you for the information. Dr. Jessica Zwirling, who's here with us, sharing with us a little bit about Bell's palsy. Thank you so much
Thank you for having me.
All righty, listen out. For more information, you can visit the website, montefiore.org, Alzheimer's Center, or you can call 914-375-4880. That number, once again, 914-375-4880. It is always better to go ahead and get checked out. Well, listen, stay tuned. We've got more Open coming up, more amazing guests. We'll be right back right after this. And welcome back. If you haven't noticed, we've dedicated most of our show today to talking about health issues and getting the word out for information and awareness. We talked about Bell's palsy, talked about breast cancer, and now yet another one. Jacobi Hospital OB/GYN department is offering several services to women, such as pap smears, mammograms, gynecological surgery, prenatal care, childbirth education, and much more. And joining us now to talk about the importance of visiting a gynecologist is Dr. Daryl Whelan, who's the interim vice chair of OB/GYN services at Jacobi Hospital. And thank you so much for being with us.
Thank you for having me.
So as we talk a little bit about this, OB/GYN care is something that many women are supposed to do. We find that sometimes some are delinquent and sometimes not even taking advantage of OBGYN services?
Right. Well, it's really important for women to have their health care, and we recommend that they come annually. I think that certainly in the reproductive ages, like between 21 and 45, oftentimes the gynecologist or women's health services is the primary care for women. And so taking the whole gamut of all their issues, their menstrual health, their sexual health, their risk for disease like sexually transmitted infections, and family planning services, deciding when you want to have a child spacing, and if you don't want to have children at all.
Right. And so I think when sometimes people hear about the word gynecologist, it's only related to one area, right? But then it's so multifaceted.
Right. I mean, I prefer actually calling it women's health services, because
Right.
I really think we take care of the whole woman, and the woman is taking care of the whole family. So it's really important that she's strong and healthy for the rest of her family.
Yeah. So give us a little bit about what you provide.
We offer all services. So we have a full floor. We offer prenatal care at the level of midwifery services, which is really a very intimate relationship with the midwife, versus high-risk services for people who have complex medical problems associated with their pregnancy. And then other women and not pregnant get GYN care. So we have cervical cancer screening, as you mentioned previously, breast cancer screening as well, and screening for sexually transmitted infections, and screening for contraceptive advice.
So talk to me a little bit about what age a woman should be visiting.
Well, we do take care of teenagers, and some teenagers are in that transition between seeing a pediatrician and then becoming a woman, an adult. And so we often take care of teens who become pregnant or don't want to become pregnant. And so, but certainly at 21, that's kind of this magic age where we tend to start the cervical cancer screening program. And that continues through 65. But a woman should really be visiting I would say a GYN annually between 21 and 50, and maybe every year to other year after that. But I don't think it ever stops.
We hear these words and sometimes all of us are not familiar with them. Pelvic exam, pap smear. So what is a pelvic exam? What's a pap smear?
Well, so they are different, and people think that if they had a pelvic exam, they had a pap smear.
Right.
But we don't have to do the pap smear as frequently as we used to in the past, which is great, but it means sometimes people forget that they should go more regularly. So the pap smear itself is some test of the cells in the cervix, and it's also testing for something called HPV, which is the human papillomavirus that can cause cervical cancer. The advantage of doing a pap smear on a regular basis is that you can catch cervical cancer so early that you would never even get cancer, and you can treat it really quite easily without ever having to go to cervical cancer. One of the risk factors that people don't really think about for cervical cancer is actually not having had a pap smear for more than 5 years. So if it's been more than 5 years, make sure you get in. The pelvic exam is actually when we're feeling the organ. So we're feeling the size of the uterus, the size of the ovaries. We're also evaluating for pain or tenderness and things like that. The advantage of doing that is we might find cysts on the ovaries or fibroids on the uterus, and both of those things can cause women to have symptoms and issues that might need some medical management, some surgical management.
I guess the optimal question is, how often should one come in for a visit?
I think I would say every year up until 50, about every year to 2 years after that.
And a mammogram test.
The mammogram is kind of funny. The different colleges are recommending different things. So you should definitely between 50 and 60 have a mammogram every year. After 60, and I would continue, most of my patients continue it annually after that as well. Between 40 and 50, there's some conflicts. I think that's a lot between the patient and her history and the interaction with her physician. So if between 40 and 50, it's usually 1 to 2 years. And also just kind of having some breast self-awareness and realizing, is there anything wrong and is there anything different, and also knowing your family history.
Are we seeing any trends coming through your office a lot? Or?
Well, one thing is something we hadn't mentioned, which is something called prolapse. So prolapse is usually a disorder of women over 50, related to having had children, going into menopause, they feel a sensation of pressure or something falling out, and sometimes also have symptoms of urgency or frequency, problems with their bladder, and so they can get checked out because there's lots of treatments for that. Some treatments are medical, some interventions, and then some surgery.
Interesting things that we got to definitely keep our women abreast. Thank you, Dr. Whelan, for coming and taking the time to share with us a little bit about this.
Thank you.
All righty, Dr. Whelan here with us in studio. Now listen, for more information, you can visit their website at nychealthandhospitals.org/Jacobi, and you can find out all the information you need there. All righty, well, we want to let you know also that we've got more shows, so stay with us. We are coming right back in a few, right after this. And we are back here on Open, and yes, we are continuing our conversation, talk about health, and September is also Thyroid Cancer Awareness Month. Columbia University Irving Medical Center treats thyroid diseases like thyroid cancer, hypothyroidism, and more. Now, the medical center is the first in the nation to develop an interventional endocrinology program. And joining us now to tell us more is Dr. Jennifer Kuo, who's the how do you pronounce it?
Endocrine surgeon.
Endocrine surgeon, I got it right, okay, at Columbia University Thyroid Center. Try putting all that together and you'll mess it up too. So good to have you. That's why we have a doctor in the house to fix up everything I mess up. Okay.
Thank you for having me.
Thank you. A lot of people are affected with thyroid disease too, and just give a little bit of a brief history as to what exactly is thyroid disease.
So thyroid disease is any disorder that's going to affect the thyroid gland. So a lot of patients have thyroid nodules, very prevalent. Up to 65% of the population will have at least one thyroid nodule. You can have hyperfunctioning or hypofunctioning of the thyroid gland, where the thyroid is not producing the right amount of thyroid hormone that the body needs, and that's separate from the presence of thyroid nodules. And then you can have thyroid cancer, and so we treat all of those thyroid diseases that can affect our patients.
And when we talk about interventional endocrinology, give us a little bit about that.
So interventional endocrinology is an emerging field where we are using non-surgical, usually image-guided techniques to treat diseases that we would normally treat with surgery. And for the current time being, a lot of those diseases are going to be thyroid disease.
In other words, Dr. Phil, how's that working for you?
It's working well. Our program has just started, but we have had really good patient experiences, and it's very exciting to offer patients who really don't want to have surgery a different intervention with good outcomes.
All right, so it's different for some, right? So how's it different in terms of, you know, what's presently out there for patients?
So a lot of the times when you have a thyroid disease that cannot be medically treated with medications or in some cases radioactive iodine, then the option is surgery. And surgery is a very, very good treatment for a lot of these patients. Generally it's a low, straightforward procedure with low risk for any surgical complications, but it's still surgery, and you still, for the most part, have to have general anesthesia. These interventional techniques allows patients to have good outcomes, address the disease, address their symptoms that they're having, but avoid surgery, avoid general anesthesia.
All right. What kind of results are we seeing so far?
Very good. So the two patient populations that are going to most benefit from these types of procedures are going to be patients with benign thyroid nodules that are causing symptoms. So they're large enough where they're causing problems with swallowing, sometimes breathing, or sometimes changes in their voice because the nodule's large enough where it's putting pressure on the nerve that's feeding the vocal cord. There's not a lot we can do, medically or otherwise, to keep these nodules from growing. So once they get to that size, the only thing that we can really offer patients is removal of that nodule. And we can't just remove just the nodule itself because it's in the thyroid gland. So we have to remove either half of the thyroid gland, which is called a lobectomy, or the whole thyroid gland, a total thyroidectomy. For patients who have a lobectomy, again, it's a good operation to have, good outcomes, but it's still surgery, there's still a scar, and about 25 to 33% of patients ultimately in their lifetime will require some thyroid hormone supplementation. So it's a medication that they have to take, one pill once a day for the rest of their life. Generally, very well tolerated medication, but patients don't some patients are very uncomfortable with the idea of removing an organ that's perfectly healthy doing what it's supposed to do just because it's big. So we can now do ultrasound-guided radiofrequency ablation where I use an ultrasound, I insert an electrode into this nodule, and the electrode emits some radiofrequency waves that allows us to burn the tissue. And over time, the nodule itself shrinks down. So it shrinks down to a size where it's no longer causing these symptoms. But since we're only targeting the nodule itself and not all the healthy tissue that's around it, the rate of thyroid hormone dependency for a patient is almost 0%. So it allows them to avoid this medication. The other population of patients where this is going to be very useful are patients with recurrent thyroid cancer. So although thyroid cancer is generally a disease that we catch very early on and we achieve high rates of surgical cure, there's that handful of patients where the disease comes back. And although surgery remains the gold standard of care, in reality, there's only so many times that we can operate in the neck in a safe manner. And so for a lot of these patients, currently it's always a discussion of the risk and benefit ratio. What is the benefit and what is the risk of going back for the third, fourth time into someone's neck? These interventional procedures allows us an extra tool to help these patients. Again, it's a very targeted technique. So if a single lymph node pops up in an operative field for the third time, we can now treat it without surgery.
Pretty interesting things. So I want to keep people aware of this and let people know a little bit more about thyroid disease. Dr. Jennifer Quirrell, thank you so much for being with us.
Thank you.
All righty. Well, listen, the Thyroid Center sees patients in Washington Heights as well as as in Westchester County. Now, if you want more information, you can visit Columbia at columbiasurgery.org /thyroid, or you can make an appointment. Call 212-305-6969. Once again, columbiasurgery.org, or call 212-305-6969. I want to let you know that we are continuing our live coverage. Bronx Borough President Ruben Diaz Jr. is actually honoring 2 Bronx heroes for their efforts on rescuing Fernie Balbuena. That's the baby that was on the number 4 train. Her father actually jumped and committed suicide, but at the same time, Fernie was able to come out, and you saw that amazing video in the beginning. Our Bronx State cameras are there. The Bronx Borough President is there. We're going to take you to it right now. Live at the Bronx County building.
But Jairo was able to coach her, and miraculously, the electricity wasn't shut off, and so the girl still wasn't hurt in her crawling from where she was at all the way to Jairo. Before I bring them up, I want to say this, and I'll say a couple of words in Spanish. I want to say, ladies and gentlemen, to those who are going to be seeing and continue to read and research this story, let this be a lesson to Bronxites, New Yorkers, and our society. Jairo went to work right after that. He went and took the D train. Think of that. With all that he saw and all that he endured, this man still found the strength. I would have went straight home to my bed. He still went to work, and it was his boss who had to tell him to go back home after his boss saw what was happening in social media and in the media and the images. Antonio raced up to the platform. He wasn't on the train. He raced up, and another lesson in our society, the majority of the people, and I get it, people are fearful in a moment of panic, but you can't be that panicked when everybody is taking out their cell phones. Courage, again, is the ability or the act of doing something under pain and grief. And that something cannot be, my fellow New Yorkers, simply pulling out your cell phone. Antonio also has a bag. Think of this. While he's assisting Jairo, he places down his bag. He has medication in that bag and other personal belongings in that bag, and that bag was taken. It was a Nick bag, correct? Whoever's out there and you took that bag, please have respect for a hero and return the bag. Damas y caballeros, brevemente en el español, Yo soy Rubén Díaz Jr., soy presidente del condado del Bronx, el condado de Papa Dios, donde cada día hemos visto actos de milagros, actos de Dios. Y la mañana del lunes, día 23 de septiembre, lamentablemente, vimos una tragedia donde un padre, se tiró entre medio del tren número 4 en la estación de Kingsbridge con su niña, su hija de 5 años. Yo no sé si psicológicamente, yo no sé si médicamente, emocionalmente, el padre tenía problemas. No sabemos. Mucha gente dice que para aquellos de nosotros que somos religiosos, que creemos en Dios, gente dice que Dios estuvo ahí ese día. Quizás usó a Jairo y al señor Antonio como herramientas, pero también sabemos que el diablo estuvo ahí también. No sé si los demonios que estaban sufriendo el padre para hacer un acto que ninguno de nosotros podemos pensar. Pero gracias a Dios que tenemos héroes. Gracias a Dios que todavía nos quedan humanos como Jairo y como Antonio, que se tiraron a rescatar a esta niña, una niña de 5 años, una niña que por el resto de su vida va a tener problemas psicológicamente. Y nosotros como sociedad tenemos que celebrar esta atención. Ellos no lo piden. Este homenaje no lo piden. Las entrevistas que le han dado no lo piden. Pero por favor que sea un mensaje a esta sociedad, a este condado, a esta ciudad, que cuando un ser humano necesita nuestra ayuda, que tenemos que hacer algo y no simplemente sacar los teléfonos celulares para grabar lo que está sucediendo, sino asistir al ser humano. A Antonio, él tenía una bolsa con su medicina y alguien allá afuera todavía tiene esa medicina. Por favor, respeten a un héroe y darle la funda, la bolsa de su medicina, denle la medicina para atrás porque él la necesita. And so with that said, before I bring them up, I just want to say, I call the Bronx God's country every single day, and I say that because God's work is happening here. That morning, we saw God's work happening right after the devil's work was happening as well. And for that, I want to bring up the Batman of the operation, our hero, Jairo Torres first. Jairo. On behalf of 1.4 million Bronxites and all New Yorkers, I want to say thank you. I want to thank you. And Antonio, come over here, Antonio. And his last name is Love, Antonio Love. Thank you for showing your love that day. Again, this is the guy who jumped in, who saw it from beginning to end, who saw and heard the father on the phone, and through it all, and as traumatizing it can be, he went on the other line, the D train, and went to work. Ladies and gentlemen, Jairo Torres. Jairo.
Buenos días a todos. La mera verdad que este reconocimiento y este honor pues nunca lo esperaba en ningún momento. Soy una persona normal que día a día lucha y trabajo para poder salir adelante en mi familia, en este país, como cada persona que se levanta buena mañana rumbo a su trabajo. Era un día normal, lunes, 7:55 de la mañana, y nunca esperé que este padre con esa niña saltaran enfrente de mí. Fue algo horrible, pero en ese momento, pues, de la magnitud de la situación que estaba pasando, en ningún momento yo pensé poder hacer algo tan grande y poder salvarle la vida a la niña. Es una gran alegría que siento en mi corazón hacer algo de tan gran magnitud, y siento una felicidad en mi corazón poder haberle salvado la vida a esa niña. Y si me tuviera la oportunidad de volver a hacerlo, por otra persona en este país, pues lo haría de nuevo, porque de corazón se lo digo, se siente tan lindo poder salvarle la vida a otra persona, y principalmente a una niña, a un angelito. Es algo lindo y que me queda, me imagino que para siempre en mi corazón y en mi vida. Esa experiencia que pasó, que realmente no la esperaba. Y fue algo bonito y algo grandioso que pasó y pasó. Fue un milagro y gracias a Dios fui parte de ese milagro, salvarle la vida a la niña. Y eso fue lo único que me importó en ese lapso del frenazo del tren, el grito de la gente. Yo solo salté, no me importó mi vida. Yo sabía que la niña estaba viva. Y la corazonada me lo dijo, la niña está viva. Y gracias a Dios que la niña está viva, está con su madre, ilesa, sin ningún rasguño, sin ningún morete. Y esa es la felicidad más grande que tengo, que se perdió una vida, la vida del padre, pero la recompensa más grande fue poder salvar a la niña. Muchas gracias. I want to say thank you everybody in this morning. It's difficult to me to explain in English because my first language is in Spanish. I'd say thank you God for everything, because about the incident this morning, the last day in the morning, is really horrible. The incident is like, they happen in front of me. And I think, I never think about my life. I think about the baby, to rescue the baby, to protect the baby. And I think I did it. I'm so happy, not about this moment, not about this thing that I had in my hand. The only thing is the baby, she's good, she's still alive. Thank you God for that thing. I can't explain this. And so I want to say thank you. Thank you for anybody stay here to listen to me, to give me this chance, to this opportunity. Priority, like I say, in these 3 seconds, is only the baby. Only for the baby.
And when I spoke to Jairo and he was giving me his version, at no time did he realize, within those less than a minute, it all happened so quickly in his mind, he didn't realize that he had somebody there helping him out. And that person was Antonio Love. Again, Ichihara Hollywood, here in the Bronx, we have Batman and Robin, and with us is Antonio Love.
Good morning, everyone. I'm just lost for words. I can't. There's no sleep for me. I don't know. I don't even want to take the credit for it. I owe this man everything. I'm just lost for words right now for what I saw. Anyways, I suffer from PTSD. So it's a lot on me right now. So I owe it all to him. He's a hero. I was just there to accomplish him, to help him out. Other than that, I'm sorry for the family. I tried to go back to get the husband, but I'm sorry, everyone. I tried. I'm sorry. I have no much to say.
Well, we want to thank you guys, and again, we know that you're not asking for this. I think that what the world sees here is we put a real face on an immigrant and someone who suffers from his own conditions, and as a society, in government, people tend to vilify certain communities. People tend not to put their resources. People continue to marginalize already marginalized individuals and communities. But here in the Bronx, if it wasn't for these two men working together, we would have had even more of a tragedy. Now, the 5-year-old girl, she's going to suffer this for the rest of her life. Psychologically, this is something that she and her family are going to have to deal with forever. But she's alive. And I would even suggest that these two individuals, you know, they are going to need continual counseling because, as you can see, Antonio says he hasn't slept, and Jairo doesn't want to take the 4 train anymore. He doesn't want to be up on that platform. He says that even when he hears the train screeching and coming to a halt, that takes a great toll on him. So we on my part, as the borough president, I want to just thank you and let you know that wherever we can be supportive, that you can always count on me and on my team. With that said, any questions? Jairo. His name is Jairo. We're going to give them a name. Jairo Torres.
So when you saw what was happening and then went down on the tracks, I'm assuming that's your little one here?
No, this is Antonio's little one here. The baby?
Oh, is it? Okay.
That's Antonio's baby and Antonio's wife.
No, I don't have children.
Okay, so Antonio, when you jumped down there and you saw what was happening, did you think of your little one?
Ma'am? Did you think of your little one when you...
Oh yeah, most definitely. Instantly. I saw him.
Speaking to him.
Yes, ma'am, most definitely. I saw him instantly. I saw my son, like instantly, like it's traumatic. Like, I don't even talk about it.
Have you guys been in touch since this happened, or you have a bond now that's incredible. I mean, I'm assuming you're going to be, you share a terrible bond, but you were that together.
Well, I had to get his number first. And then I think, yeah, I think yes. Should be my friend.
Raúl.
Yes.
En español, sí me puedes decir si hay algún incremento en las ayudas para las personas que están con depresión o que necesitan ayuda para reducir.
Bueno, sí, no solamente la tenemos en nuestra oficina, los oficiales electos, también hay la línea de hotline que tiene la ciudad de Nueva York, y también en las plataformas del tren. Ellos tienen un botón, y yo creo que necesitamos seguir educando a nuestra comunidad. Yo no sé definitivamente de lo que estaba sufriendo este padre. Obviamente fue algo, pero a cualquier persona que piensa quitarse su vida, que se siente deprimido, hay ayuda, y eso es algo que nosotros como sociedad tenemos que seguir hablando. La sufre el señor Antonio Love. La medicina que él tenía esa mañana está en la cartera que él dejó ahí para salvar o asistir al señor Jairo, y le llevaron esa medicina. Esto es algo donde una persona no se tiene que sentir abochornado. En todas nuestras familias, en mi familia hay gente sufriendo de condiciones de mental, y en todas nuestras familias. Y ya ha llegado el momento donde como sociedad nosotros tenemos que hablar de eso, si no, la gente se siente abochornada, se siente que no hay asistencia, y posiblemente vamos a seguir viendo un padre, no un extranjero, un padre que hizo lo que hizo con su hijo. Yeah, she asked about whether or not we have services for mental health issues, and I said we certainly have information in all of our offices. There's information in libraries, in the elected officials' office. Obviously, you all know that we have a hotline. Every level of government is trying to address this. There are different organizations, there's supportive housing. You know, we need to stop stigmatizing mental health. I do not know what this father was going through. I don't know if he was diagnosed. But obviously he was going through something. He wasn't a stranger. He wasn't somebody who pushed an individual into the track. This is a father who conscientiously grabbed his daughter's hand, his 5-year-old daughter's hand, and threw himself, even when his family says that they didn't see anything wrong that morning. And so we have to continue as government to provide the services, continue to be targeted, continue to speak on it, because my family suffers from mental health issues. I have family members, and I'm sure that every one of the majority of the people here as well.
What you're seeing was a live look at Bronx Borough President Ruben Diaz Jr. at talking about the 2 heroes in our borough diving in and saving that 4-year-old, or I should say that 5-year-old child, Gairo Torres, Antonio Love, stepping in and pulling that baby off of the tracks in what is known as an amazing viral video. The 2 being hailed as heroes. Bronx Borough President Ruben Diaz Jr. talking more about the need for mental health services, not using mental health as a stigma, but also creating services and taking advantage of the services that we're aware. And for those that are just joining us, this is a special celebration being held down at the Bronx County building, celebrating the 2 heroes who pulled that baby off the tracks. Don't go anywhere. We've got more open. Stay with us, including a very special guest right after this. And welcome back. Equal Standard is a film following the lives of New York City police officers caught in an inner-city conflict resulting in a tragic death. The film reflects on the injustice occurring across the country between innocent civilians and the police department. Here now to tell us more about the movie is Tahim Bryan, creator and executive producer of Equal Standard Film, and Tretch, actor, producer, legendary hip-hop artist, here with us as well. Thank you both for coming and sharing with us.
Glad to be here.
Good. And I'll start with Tahim first. You know, you got to be excited.
Very, very much excited.
Tomorrow's going to be the screening.
The big day.
And but you really tackle a real serious issue. And so you took on police brutality.
Correct.
And the public. And this is something that we continue to see every day.
Correct.
Talk about why you wanted to bring this to film.
Well, you know, it's 2019, and you see how this administration is supporting division right now. So this is something that was well needed. This is a storyline that's not really dealing with the marching like most movies you see that I'm kind of tired of marching, my feet hurt, you know what I mean? So we kind of taking it to another level of accountability that's not really being enforced with the criminal justice system, but it's being handed down with us. So this was, I think, a piece that was really needed to be pushed out into the forefront to show them that accountability has to be a moral obligation to everyone equally, and everyone understands what equal standard really stands for, is a fair merit. Each piece could understand that everyone wants to be treated fairly. So that's where equal standard had to be developed and put out there.
So what are we going to see? What's the public going to see when it comes to equal standard?
You're going to see a lot of different things. You're going to see betrayal. You're going to see also blue-collar cover-up. You're going to see unity between the Crips and the Bloods coming together, uniting, as well fighting with each other against the brutality. You're going to see love. You know, most of the things that you see that's going on in the world today, that's going to really be enforced inside this film right here.
And Tretch, you get the opportunity to play a major gang leader called Trigger.
Yeah.
How does Trigger play in all this?
Well, it's just being tired of the situation that's going on in the streets and coming to the point of no matter how much rivalry's been going on, that it's a time to get together on the streets because we the underdogs, we endangered, and it's like, only thing we could do is help them by killing each other. Now it's time to get over and show force because it's power with numbers. So that's why the whole thing goes into getting the troops together for the first time.
We often hear about artists not being involved and being socially active and connected. Here you are connected to a film, right, that deals a lot with the issues that we're facing day to day. For you as an artist, is this part of your give back?
Yeah, man. I mean, I'm a raptivist. You feel what I'm saying? I put it together. But no, it's just a serious situation. Back in our era, it's like you heard more music built around social issues and things that's going on in the communities. And a lot now you just hear mainly partying and dancing and everything else. So this is my way through our tours and everything else, but especially through film, you reach so many people, and a lot of people follow that. So you got to put the message in there. That's why I love working with Taheem, because it always comes down like that with him.
And he puts together an all-star cast. Talk about the cast that you got working with you.
We got like 99 actors, right? So it's from Trigger, you know what I mean? We got Ice-T that also plays leader of the Crips. You have Hassan, that's Weebay, that played in The Wire. You got Mark Jeffries. You got Fredro, you got Selena Johnson, Tobias Trevelyan that played in Empire, Robert Colossi, his first movie with both of his sons as well, Miles and Byron. So it's a star-studded cast. And you got Maurice Bernard from General Hospital that plays Captain Chavon. So I'm blessed to see all these brothers that came out to support this movement right here, because that's what it is. It's a movement.
Right. And you're just behind the scenes, you're directing, you're producing.
And I'm also playing an actor called Blue in there as well. So I'm a Crip member as well. So I'm wearing multiple hats. So why not?
Right,
you know?
right. So what's the feeling like going into tomorrow? I mean, is there a lot of nervousness?
Of course it's jitteries, you know what I mean? But it's excitement, you know what I mean? It's actually seeing how my dream became a reality, you know what I mean? It's basically triumph after struggle. I will put it in so many words, you know what I mean? It's surreal.
Right.
It's surreal, but it's a blessing.
Right.
It's a blessing.
Nervousness. Well, we'll talk through this. Nervousness on your part, right? And then the second part is how much really is it about acting, given the fact that you live it day to day?
I mean, because you have to be somebody else, a different character. You know, I've been acting for over 2 decades now, so I never want anyone to look at my one character and like, this the same dude from Jason's Lyric, or this the same dude from this, or this, or this. You know what I mean? So it's just bringing a light to a whole different character, a whole different area, a whole different situation. There's a ghetto everywhere, but it's like it's a whole different vibe, whether you're on the West Coast, Midwest, down South, or the East Coast. So just to bring that up into it is just, it's like a new dance to create. You feel me? It's beautiful.
Yeah. So tomorrow's a premiere. After that, what happens from there?
Well, you know, the after party. So, you know, the after show is the after party.
Right.
So we have that. Then distribution, you know what I mean? Try to land with the right home and continue on. We also got another project that we're doing together called Southside. That's based in 1988. The first season is written. So we're going to move forward with that, bring it back to the golden era, educate the youth, you know what I mean, that kind of lost and went sidetracked from the way today's generation is going. So I'm hyped.
Yeah, I mean, you're using film for social activism. I think we're hyped too.
You have to, you know, because education is not only taught through books no more, it's visual education now. So people really see and respond off what they see on television, and then the talent that they identify with that they grew up to from listening through music or watching through other films. So you have to target the demographics in a visual format right now. I think that's the best way today to use your voice, right?
Work in the wisdom.
Right. So you got the acting career. People ask what's up with the music. Are you still, what's going on?
Yeah,
man?
We still on tour. We about 150 shows a year on the average for 28 years. So, you know, we stay out there, stay in the studio, and just hit the ground with it, man. But it's like, just to change hats and to be able to do all, it's like, it's the best high.
Right. All right. We gotta go, but we're gonna talk about changing hats. You know, we talked a little bit about him being that diehard Giants fan.
Let's go Big Blue.
Yeah, okay. Got a lucky win this week. You know?
Yeah, we'll take it.
A W is a W. What'd you say they usually call you when you walk in?
Yeah, before I was going like, yo, what's up, Owen? I'm like, who's Owen? Owen 1, Owen 2. I said, oh, y'all slicks. Yeah. I got that. Not this year.
Not this year.
Not this year.
Well, all right. Well, thank you. Tresh, good to have you, bro. Hey,
right,
man. Tight.
Thanks for having me.
Hey, man. Thank you. Listen, want to let you know Equal Standard Film premiere is taking place tomorrow, September 26th at the Museum of Moving Image located 3601 35th Avenue in Queens. The red carpet is actually happening from 6:45 to 7:45, and the premiere starts at 8 p.m. Now, if you want more information, you can follow them on Twitter at Equal Standard or on Instagram at Equal Standard. Well, yes, we've come to the end of our show today. I want to thank our guests for joining us, and most of all, you, the viewer, for tuning in. If you missed any part of today's show, you can catch the recablecast at 5 and 10 p.m. on Optimum's Channel 67. Verizon Fios, that would be Channel 33, or watch us anytime on the web at bronxnet.org. That wraps it up for this special edition of Open. Want to make sure that you keep this channel wide open. Special shout out to all those watching simultaneously on the M&N channel. Give a special shout out to the sister family. Good to see you. Take care, everybody. God bless. We'll talk to you soon.